So welcome to UK News. Today we have the news. The doctor said the patient should not always complete the course of antibiotics. Experts said that reducing unnecessary antibiotic use is essential to eliminate antibiotic resistance, missing their effectiveness. This is the template of the medicine. Patients should not be forced to complete the course of antibiotics medicine. Experts written in the British Medical Journal argue the warning given at the start of treatment is not backed by evidence. The professional Martin Llewelyn at Brighton and Sussex Medical School and College say patients are put at unnecessary risk of antibiotic resistance when treatment is given for longer than necessary, not when it is stopped early. They said that traditionally antibiotics are prescribed for recommended treatment courses, and fundamental to this concept is the notion that shorter treatment would be more inferior. They add that for most education studies to identify the minimized effective treatment duration simply have not been performed. To complete the coordination, ignore the fact that different patients respond to treatments in different ways. Deciding currently, we largely ignore this fact and instead make education-specific recommendations for antibiotic duration that are based on poor evidence. This is the picture. This situation is changing in hospital practice where the biomarkers of treatment response can guide when to stop antibiotic treatment. Outside hospital where the repeated testing may not be feasible, patients may be advised to stop treatment when they feel better. Indirect contradictions of World Health Organization's advice. For common bacterial infections, no evidence exists that stopping antibiotic treatment early increases a patient's risk of resistant infection, the experts say. Reducing unnecessary antibiotic use is essential to imitate antibiotic resistance, they argued, adding that antibiotics are a precious and finite natural resource which should be given to each patient with tailored treatment duration. They say research is need to determine the most approximate simple alternate message such as stop when they feel better. Commenting on the paper, spokesman for Royal Paramedical Society and consultant paramedics Dr. Ren had said, this opinion article from respected NHS infection expert is a welcome opening of the debate in the UK on the relationship between the length of a course of the antibiotic efficacy and resistance. As the researchers have pointed out, the further research is needed before the finish the course. The mantra for antibiotic is change, and any alternative message such as stop when they feel better can be confidently evocated. It is important to consider the fate of the leftover antibiotic if patients are told to stop when they feel better. Patients should be encouraged to return the usual antibiotic to pharmacy for safe and disposal rather than putting them in the bin, and even worse, saving them for future use and sharing them with their friends and family could really contribute towards antibiotic resistance. The ideal future scenario would be at the right time of treatment of specific infection for the parents is identified from clinical trials and actual quantity needed as a prescribed and dispensed. In recent years, there has been a UK drive to raise global awareness of the threat posed to modern medicine by antibiotic resistance. If antibiotics lose the effectiveness, then key medical procedures including gut surgery, cancer sections, joint replacement, and chemotherapy could become too dangerous to perform. Around 700,000 people around the world die annually due to drug-resistant infections such as TB, HIV, and malaria. Yeah, this is the end of the video. Thank you very much for your enjoy video. I hope that you will know this video, and then I hope that you will subscribe UK's channel to get more news. Thank you.